Measuring the right thing and interpreting it correctly is the key. Some research even links low T3 directly to higher mortality risk, especially in cardiac patients. It's not just about feeling sluggish. The optimal difference. What happens when we actually aim for these optimal levels guided by symptoms? For men, the potential benefits of testosterone can be quite profound based on the research. We're talking about potentially reducing dangerous visceral fat, the stuff around your organs, improving lipid profiles, and some studies even suggest it could help reverse arterial plaque progression and significantly decrease overall mortality risk. There's even evidence linking it to improving, sometimes even resolving, type 2 diabetes. For menopausal women, optimizing oral estradiol, the bioidentical kind, has shown really dramatic improvements in lipids, reducing visceral fat, lowering cardiovascular disease risk, and importantly, randomized controlled trials have actually shown it reduces breast cancer incidence, which might surprise some people given past controversies. Plus, better memory, cognitive function, potentially increased longevity. And optimal progesterone, again, the bioidentical form, not synthetic progestins, that's a key distinction, also appears protective against breast cancer and heart disease. Their structures are different, so they act differently in the body. Even optimizing something like DHEA, which often gets overlooked, can help prevent metabolic syndrome, reduce belly fat, and improve insulin sensitivity. Again, levels might be technically normal, but maybe not optimal for preventing those specific issues. Ultimately, it comes down to the provider, someone who looks beyond the standard printout, a provider who understands optimal and will adjust things based on your unique response and your symptoms, not just checking a box on a lab report. Another important consideration and kind of an interesting point is that sometimes the sicker someone is, metabolically speaking, the higher their optimal hormone levels might need to be to overcome underlying issues, like hormone resistance at the cellular level. With such long-standing beliefs and guidelines that don't reflect this optimal approach, it can be challenging to advocate for yourself and find the right provider. A lot of common medical beliefs, like the old fear about oral estrogen causing blood clots, or maybe the idea that statins are always the best first step for everyone, are sometimes based on older studies, or maybe studies that didn't differentiate between, say, synthetic progestins and bioidentical progesterone, or perhaps there's some confirmation bias. You know, it's hard to change established ways of thinking, even with new evidence. It's about finding someone who stays current, who questions the status quo.